Good evening, everyone. My name is Jarawee Rattanasiriwongwut.
Good evening, my name is Nareenut Saifa.
Now we're gonna show you how to use the electrical stimulator in denervated patient and partial denervated patient.
How to use and how to treat the patient. We will show you. Let's go! Type of denervation. There are two types of denervation. First, complete denervation is the condition of lacking of nerve supply to the muscle completely. The result of complete denervation in patient will be flaccid paralysis and areflexia. The Kanokthip value of complete denervated patient is more than 10 milliseconds. Second is partial denervation. It is the condition of partial lacking of nerve supply to the muscle. The Kanokthip value of this type is equal to 1 to 10 milliseconds, and result of patient will be in weakness or hyporeflexia. The purpose of electrical stimulating in partial denervated and complete denervated patients are 1. Delay muscle atrophy, 2. Maintain muscle extensibility, and 3. Maintain muscle property.
For the frequency will find by frequency equal to 1000 divided by pulse duration plus pulse interval. Time. The time for treatment depends on the frequency and number of muscles in monopolar technique, but in bipolar technique usually use about 15 to 20 minutes in treatment.
For contraindication of the electrical stimulating treatment, there are cardiac, pacemaker, and pregnant or open wound, malignant or severe of hypo and hypertension.
Let me introduce the equipment of electrical. First, mental foil, electrode plate, step, cotton with alcohol, point electrode, cable. Back line is negative, red line is positive. For sonopole machine, the equipment of sonopole is at first the cable, carbon electrode, point electrode, Velcro, cotton with alcohol, and this one with spongy.
The technique of placing electrode of electrical stimulation. There are two techniques of placing electrode. First is monopolar. Is place positive electrode at the outer area, same side body, and use negative polar as active electrode in terms of point electrode. Check firmly contact point electrode at motor point of muscle and firmly slide the point electrode to other muscle. We will use this technique for unparalleled muscle. The second is bipolar technique. Is used on the area that the group of muscle is parallel to each other and parallel to nerve supply fiber. The position of both electrodes are proximal 1/3 and distal 2/3 of muscle belly.
Now I'm gonna treat the denervated patient. First, we should test the electrical current first. Now I'm gonna plug in to the machine and the other to the carbon electrode. And test the electrical current. I feel the electrical current, okay? And then we're gonna apply to the patient. First, we apply the alcohol to the patient's skin to reduce the resistance. And then we place the electrode on the proximal 1/3 of muscle belly and strike it firmly. And another one to 2/3 proximal muscle belly. And then for using the bipolar technique in the denervated patient, we're gonna set the sonopulse parameter to be. We use electrotherapy, and then we use occurrent waveform, and then we use Faraday current. Now we're gonna shoot rectangular waveform and choose the channel. The treatment time will be 15 to 20 minutes. I'm gonna use 20 minutes. The duration is same to be the Kanokthip value. I assume to be 10 milliseconds. And phase interval is 1000 milliseconds or 1 second. And then we apply the intensity to the muscle contraction in maximal contraction.
After I test the electrical current, now I will apply the alcohol on the patient's skin to reduce the resistance about lotion or other. Now I will apply the electrode on proximal 1/3 of muscle and stick the electrode with the velcro. Check is to be firm. And this one on the 2/3. And now we will apply the intensity to see the contraction to maximum contraction. Maximum contraction is when we increase the intensity, contraction is the same. Now, setting for partial denervated patient is pulse interval to 1000 millisecond, and chronicity of partial denervated patient is during 1 to 10 millisecond. I assume as 5 millisecond, and I will shoot the current waveform is triangular. And now I will set time. At first we will find the motor point, and at first in minimal contraction. Okay. When we find the motor point, we will increase the intensity to maximum contraction.
Now I'm gonna treat denervated patient with monopolar technique by use rectangular waveform, and pulse interval is the same, the chronicity value, and adjust the time proper to amount of the muscle contraction.